This podcast is a production of WCWP, LIU Public Radio. Check out our lineup of original programs, listen live, or support by visiting WCWP.org.
The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Welcome to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Lohse. Hello, Otto.
Good morning, John.
I'm sorry I missed you again last week. We go back and forth, it seems, on certain weeks, but nevertheless, we're all here together today, which is great. And of course, this is another tremendous show that Christina Liu has put together, producer extraordinaire, and today we have with us Kathleen Otte. And Kathleen Otte is the regional, bi-regional administrator for the Administration for Community Living, ACL. But I think Christina knows this. Before we go to Kathleen, Barry Klitzberg comes from Kathleen. And that was how many years ago? And since then, Barry's been on shows or been involved with Project Independence in one way or the other, but he was Kathleen's original referral. And I don't remember the story why. Kathleen, hello, and thank you for coming. Do you remember the situation, how we wound up with Barry?
I totally do, John. You had called and asked for someone to do a speaking engagement. Barry was available because he absolutely loves to be in front of a microphone or a television to share information about senior services. So he jumped at the chance. He got to meet you. And then I think a few years later, I had that wonderful opportunity. So, but Barry's an outstanding representation of really having great knowledge and information about services for older adults.
He really has it. He's been a tremendous asset. Christina?
He's actually coming on in September. The first Friday in September, Barry will be on.
Oh, is he really?
You know, that you did a little promotion without even knowing.
That's awesome.
I had no idea. See, Christina, in order to have Christina calm, she has to book at least 2 months in advance. Otherwise, she's out of her mind. I'm surprised Christmas is important.
I know. It's really hard in this pandemic doing all this, but you got to do it.
Kathleen,
Yes,
where we
indeed.
want to go today is talking about seniors aging in these crazy times. And you know, today, I think it was yesterday or the day before, the numbers are going wild again now. I mean, everybody thought this was going to be great and it's forgotten about. Not everybody, but there are enough people. And then all of a sudden we're having a resurgence a resurgence that's going on whilst I would personally think half the population thinks it's over. We're caught in the middle here with somebody saying it's not a big deal. You know, the fear that existed 2 months today, I don't sense it anymore. Yet the numbers are coming in staggering with new cases each day. How does a senior deal with this?
Well, this has been such a challenging time. We've built a wonderful network to encourage people to remain at home, to have the services brought to them. And we really recognize on a national level that it's much less expensive to care for people, older people, in the homes versus a nursing facility. So our aging network has adapted over the years. We've certainly been able to design programs to meet their needs, but when the pandemic came along, we had to completely shift our entire way of thinking. And to give you a good example of how quickly our network could change, and certainly Nassau County is one of those that did so, we had to stop our congregate meal service, quickly, within 2 days' time, convert it into a home-delivered meal program. And not only did we do that, but we saw a 55% increase in the number of people who were requesting meals. So our aging network, again, to keep and maintain people in the community, has really had to reorganize and has had to implement these wonderful programs that keep people alive and keep them in their community, but look at the long sustainability of it, not just a month or two, but for 6 to 7 months. And that requires volunteer effort in addition to the staff at the county area agencies on aging. It's an unbelievable effort, but it's for the right cause. And we've done a great job.
Get Otto.
When you say we, For those of us who don't know who we is, who is we?
Oh,
Like
I think
who is ACL, and a little bit of a background for people who just don't know. I don't know, to be
Yeah.
honest about it, other than doing my homework. But
certainly. No, Otto, it's a great question. And I think it's also a backsided compliment, because when people receive the services, they look at their local partners, the person who's delivering the meal, and it's appreciated. But the Older Americans Act is the organizing legislation that provided this opportunity. Back in 1965, we had the Older Americans Act promulgated. It set up our aging network, which means a system of ways to deliver services. Our area agencies on aging were established at that time. And so the federal dollars are appropriated by Congress. They come to, the federal dollars come to our state government, in this instance, New York State Office for the Aging. Those federal funds go to area agencies on aging, and they, at a community level, implement the service. So that's the Aging Network, which again comes about because of the Older Americans Act of 1965. But the Administration on Aging was also part of the Older Americans Act back in 1965. We remained the Administration on Aging until 2012, when we merged with Disability Services, recognizing we had the same mission, which was to encourage people to remain active and engaged in their communities. So the Administration on Aging still exists, but the Administration for Community Living is out there really providing the services to our state partners and ultimately to our county partners. And that's a thumbnail sketch, but I think it really does a nice job of showing how partners work together to deliver a service.
yeah, from what I gather in reading, ACL pulls together a lot of resources that if we tried to contact these resources, we would have to make 100 phone calls in order to get anywhere. Yeah, is that kind of like the picture? In other words, you pull together
We do.
these resources?
Yes, Otto, and that's a good observation, because we want to minimize that. So you have 311, of course, in Nassau County, which can help get you to local resources, but also New York Connects, which is an aging and disability resource center statewide, can make one phone call go a long way. So for example, if somebody needed a home delivered meal, you could call 311, or you could call New York Connects. They have an 800 number, and they are also in every county. You can get information about community resources. We really want to make sure that whoever is calling gets immediate response, and they don't have to go through those many calls to try to find the services that they need.
Kathleen, I have a question.
Sure.
When we first started the conversation, you referred to the increase in people needing food.
Yes. Yes.
How does that come about? That's the one thing throughout this whole pandemic, and you see the food lines all over the country. Even here on Nassau County, Laura Curran is doing a tremendous job in making sure people are taken care of, but those lines have dramatically increased. Is that strictly because of unemployment, or people were too embarrassed to come forward, or what? I'm just grasping at straws as to what the answer is.
Well, and I appreciate your question, and it's really a multitude of answers. But what we do know is that under the Older Americans Act, people, it's not means tested, but people have to meet certain criteria. They need to be over the age of 60. They have to have a need. So what we found in this pandemic is that we were serving 100 people, we'll say. And then all of a sudden, they couldn't get out of their house to do their grocery shopping. So all of a sudden, in a day's time, they needed a meal delivered. That's what we've seen across the nation.
Okay.
Is the numbers have skyrocketed because people couldn't get out, they couldn't get the groceries, they perhaps did not have family members that could help them, and truly they were self-isolating without food. And so again, all of our agencies on aging in every county really wants to negate that by making sure that they receive at least one meal a day, 5 days a week, if not more, in their communities. And that's how we're trying to combat this. And that is really why we're seeing an increased number of people asking for meals.
Okay, that makes sense. I didn't understand it. Otto?
Well, basically, you used the word need. And from what I've read, one of the things about ACL sounds like if you have a need, it could be a lot of different kinds of needs. It could be food, it could be human isolation,
Yes.
it could be many needs. And from what I can gather, the end result is that people can individually contact ACL, but more than likely it would come through a professional service, perhaps like a Project Independence
Yes.
would contact ACL and get guidance. Am I reading this correctly?
Well, yes, in a way, Otto. And again, it's a good question because people really want to know how they can receive services. We look at, from the federal perspective, our partner is the state. So in my work as a regional administrator, I represent New York, New Jersey, Puerto Rico, and Virgin Islands. Not such a bad territory to represent, and I'm honored to do that. But we work strictly with the state governments. They in turn work with the area agencies on aging, and then county area agencies on aging work with locally. If somebody were to call my office, I would be picking up the phone and calling a county AAA or the state making a referral. Again, we want to get people to their local resource so that their needs can be served right away. If they were to go through federal government into state government, there's a delay, and we don't want that to happen.
So basically, you could be a resource for Project Independence, let's say, a social worker, nurse who
Yes.
finds a need for a family or individuals, and they may talk to you, for example, for guidance as to how to handle this particular need. Is
Yes.
that
Exactly right. And we're there, you know, we have many years of experience in the aging field. And again, with our positions in the region, we know of local resources. So as an example, in a community that has a particular need, and I'm making this up, but if indeed somebody in the community really wants to learn about how to utilize technology, I happen to know of resources that are available that can teach and provide instruction to older adults on how to use the internet, how to tweet, how to, you know, do the things that they need to do like Zoom so that they can stay connected with their family. I can actually make that referral, and all of a sudden we have people with resources to meet their needs. And that's how it works, which is really a good thing because we're using the local resources to get that job done.
how do you ever keep up with all these possible resources?
You know, it's very challenging, especially in this day and time, because COVID has presented us with that opportunity. And I'll just share briefly that I'm so proud to represent the states that I do because innovation has just exploded. I'll give you a good example. Robotic pets. You can purchase them on Amazon for $100. New York State bought 1,500 of them in addition to what they had initially started. But they found that people living alone needed a pet, something they could talk to, something that would respond to them, and something that didn't require them to get up in the middle of the night and take them outside. The robotic pet program has just skyrocketed. It's not just for people with dementia, although it's helpful, but people who are isolated now have something that they can touch, hold, love, and talk to help them get through this pandemic. And it's been an outstanding program. The nation has looked at New York and is replicating this program. Again, social isolation and this pandemic has allowed innovation to explode. And I'm so proud of New York because we've really set the pace for the nation in many regards.
That's amazing. Actually, we're going to take a break at this point. I'm going to be back with Kathleen Otte. You're listening to Senior Talk Radio here on 88.1 FM and WCWP.org. We'll be right back.
Project Independence is the Aging in Place initiative of the town of North Hempstead. Some of the many services we offer include nursing and social work services. Call 311 or 869-6311 to get more information or receive services.
Welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Lohse.
still going?
And we are here with Kathleen Otte, who is the bi-regional administrator for the Administration for Community Living, otherwise known as ACL. And just before we went to the break, Otto and Kathleen were talking about this robotic dog and the need for people to have some sort of companionship. And I don't mean companionship as a robotic dog will ever take the place of a human. So don't misinterpret what I'm saying, but it's something to pass time, so to speak, whether it's TV, the radio, etc. And Otto was talking about Alexis and wanted to say something. So let's go to Otto.
Well, yeah, as you know, I've been pushing the idea of something like an Alexa, because I think there's so many things that can be done. You know, Alexa, play Perry Como, or Alexa, call my daughter, or Alexa, you know, whatever you feel like asking Alexa, she'll say something or he'll say something. And it's kind of like a robotic pet in a way. You could treat Alexa like a collie if you want, you know. It's a way that I believe that you don't feel completely isolated. Somebody can talk back to you and entertain you, if you will. What's your thoughts with that?
Kathleen, before you answer that, Kathleen, I have to jump in and do a personal sharing. My Noah, who is my 6-year-old grandson, he's my second out of 6, they have Alexa in their bathroom. He dances in the shower and he's yelling to Alexa to change the song. And I'm in there and I videoed him once. And then I said, I can't do this. He has nothing on, and I'm videoing him in the shower dancing to the new tune he wants from Alexa. But go ahead, Kathleen.
Well, no, that's a great story. I'm reminded as Otto is speaking about the movie that was out many years ago. I believe it was called Castaway. Tom Hanks actually starred in this. And if you remember, he too was socially isolated on an island, and all of a sudden a volleyball comes up, and I can't recall the name of the volleyball. Wilson, of course. So he named Wilson, and he had conversations with Wilson, and that is what kept him sane, if you will, on that island. It's that human touch, or at least that human expression, that we find that we all need, that connectivity of something to give us focus and to give us an opportunity to share. That's what's been really challenging about this pandemic, is that people have lost that ability to have the human touch. But these robotic pets fill a need. And again, they really have been a lifesaver for many people, much like Wilson was for Tom Hanks. It's just really, there's a lot of analogy there.
It's very funny because I did see that movie, and Tom Hanks won the Academy Award that year. And I thought the movie was no good. I didn't think he was any good. Now honestly, I mean it sincerely, but now what you just brought up is so empowering. I was like, that was a powerful movie. I never looked at it from that perspective. But that basketball or whatever it was saved his life.
It did. And we're finding little things like that. And I'll tell you a couple of things more. Many times caregivers who are providing care in the home, they need that little extra help, like Alexa or something to help them. We have on our website a full cadre of resources for caregivers, one of which is a fidget blanket, which I had never heard of until the pandemic. But for caregivers who are providing care to people who may have some dementia, these fidget blankets are blankets that you can, again, purchase on Amazon, and little creative ideas around each block. So people are engaged, they're focused, and the caregiver gets a little bit of a respite. Again, all kinds of wonderful, innovative products and services are coming forward. But I just want to compliment Otto and you too, John, because you're right. Nothing replaces human beings. Nothing replaces human services. And while we're in this pandemic and know that perhaps someday it will end, that our reality will be different, we never really want to forget that human services are really very much important as health services in the long run.
Yeah, that's an interesting differentiation, that human services, I noticed in your recap that you sent out, versus health services. I think we overlook that a lot of times.
We do. And Otto, I would also tell you, our city and county governments have taken for granted that home delivered meals will always continue. And then when we had this pandemic, our governor in the state of New York actually said that people who deliver meals, many of them are volunteers, people who deliver meals should be designated as an essential worker. And all of a sudden, our area agency on aging staff members, as well as those volunteers, were given a higher recognition, because the value of their work, of human services work, was now deeply appreciated. So I think, again, there are some wonderful lessons learned from this pandemic, and I think that is truly one of them.
Oh, I'm sorry. I thought Otto was going to say something. What I wanted to do
I
is
was just breathing.
Thank God for Otto breathing. No, actually, and the reason I was pointing and thinking of Otto is one of the things that was brought up is reconnecting to your roots. And Otto, and that's why I was going Otto in my mind. I'm already at 5 minutes ahead on this conversation. That's Otto's forte. I mean, Otto has put together books and pictures, and he's taken the pictures and digitized them. And has done such work that is so tremendous that at a time like this, and he did it prior to this has nothing to do with Corona. This is an Otto project. Otto doesn't exist without projects. No, which is 100%. That's an admirable trait. I'm having trouble with words today, but it's very true. But even at a time like this, is when a person can go into the attic and bring down some of the folders and go through them and say, "My God, look at this picture."
Well, we've in the past we've talked about this. First of all, you have to have the will to want to do it. If you don't have the will to want to do it, it's not going to happen. And then you have to understand that this doesn't happen in 5 minutes. This stuff takes time. And I've been working on it for years. And you do like the story about eating the elephant one bite at a time. And this is a time with COVID right now where those kinds of things can be done. As opposed to sitting in a chair doing nothing. It's a time where you can do things that may be beneficial to other people in the long haul. All these pictures, I'm thinking someday I'm not here. Maybe my great-grandchildren's children or whatever might look at these things and say, wow, who was that screwball that put all these things together back in those days? And maybe, as a matter of fact, part of what I do is I call this thing called a hodgepodge, which is really a hodgepodge of stuff that goes on up here. And COVID right now is one that I want to add to it. It's a piece of history that is probably one of the more complicated, more difficult times in my lifetime, and I've been around for a while. It's something that shouldn't be forgotten too easily. We do tend to forget what took place in the past and redo it all over again. We went through things like this before. This isn't the first time in the history of the world that a COVID or pandemic has existed. And, how do we get people to not forget? I don't know. I don't have a magic answer to that one, but it would be good if we did.
Well, you're right. And again, it just underscores that need for that human touch, staying involved, interested in your community, giving back to your community. So many volunteers have come down with COVID-19. We actually in New York have lost some of our older adults who were volunteers delivering meals or taking people to medical appointments because they contracted the disease. But that interest in staying active, giving back to your community, and really feeling a purpose in life is really what makes a worthwhile life to live. And I think that, Otto, you're right. If we don't take the time to look at what this pandemic has given us in terms of the good and the bad, but be able to capture it, will be better for the next go around. And this could last for a while, as we all know. So we're learning things, we're documenting things, and that's why at ACL, we're really focusing on state innovation. And again, it bears repeating because it's earned and it's deserved. New York and New Jersey have paved the way for the nation on some of the things that they're doing, which is keeping the people engaged in their community. Phone banks, calling people, making sure people are still doing great. An active telephone visitor program is essential to keep people engaged in their community. So I couldn't agree with you more. I think it's something that we all need, but especially as we grow older. Keep focused, keep giving back to your community.
Just a different story. I read something the other day in reference to houses. And you have a brick house, which is supposed to be very strong, and you can have a wood house. And it went to the houses in Greece. And the houses in Greece are painted every year. And some of them are made of junk, but it makes no difference because they're painted and taken care of every year. and the maintenance is what keeps it going. And it's the same thing with human relationships. If I don't call Otto for a year, we're going to break contact. I see Otto basically every week. And over the last year, Otto and I have a relationship. But it's worked. There's no question about it. Now we don't see each other because of this, but when this is finally over and there's some things in my life that are over, we're going to be partying. Him and I are going to Las Vegas probably with Christina.
Yeah.
And Dan, the four of us are going to get on a plane, whatever, that Hangover movie.
You know, that's another
It's the
thing.
truth.
But there are some people that no matter how hard you try to get them to make a phone call, or, you know, it just doesn't work. You know, I can't.
That's
You
true.
know, I mean, in some cases, it's just who we are. We're different people, all of us. But then every now and then you have to kind of push yourself to do something that maybe is not in your natural comfort zone. And frankly, some people maybe are happy without that. I don't know. And that's the way it is. I mean, that's what makes the world go around. And then there are other people that are on the pity pot where, you know, poor me. And, you know, everybody's gone through stuff in life, and you know, that most people really don't care when you're on a pity pot, to be blunt about it.
Well, that's true, Otto. And we had a very very concerning headline that appeared in the Chicago News about 5 weeks ago, where people who stayed at home because of the pandemic, they didn't reach out to family, nor did anyone reach into them. They found these people dead. And this is not just one or two cases. So the opposite of the interaction could be death, as it relates to people who socially isolate and they don't have family members. And again, what drives all of our volunteers to prohibit that, to keep people engaged. And they're really saints, if you will, because they, through their own adversity, are continuing to give back. And ultimately, what we know from science is that it helps them mentally as well.
The most important thing is there's many opportunities for families to get together and come up with some creative ways to enjoy themselves and each other. And what we're going to do is we're going to take a break, and when we come back from the break, we're going to go through these things. But right now, you're listening to Senior Talk Radio on 88.1 FM and WCWP.org. We'll be right back.
Project Independence is the Aging in Place initiative of the town of North Hempstead. Some of the many services we offer include fitness classes, community education, information, and referral. Call 311 or 869-6311 to get more information or receive services.
Welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Lohse. And we are very fortunate to have with us today Kathleen Otte, who is the Bi-Regional Administrator for the Administration for Community Living, otherwise known as ACL. And, you know, we're already halfway through this segment, and there's just so much stuff to cover. That actually I'm going to go to Otto first. We'll do Otto's one, because I think that's important, Otto, what you were just talking about in reference to institutional versus.
One of the things in preparing for this, Kathleen, is that an area that ACL gets involved with is the thinking of community living as opposed to institutional living, if you want to call it that in some cases. You know, just generally, you know, when people get to a point where they have a problem doing the basics like getting dressed or eating or whatever, you know, what's the resources that are out there for that?
Well, under the Older Americans Act, again, back in 1965, the whole premise was to keep people engaged in their community. So we have a long history of that, and we use nutrition services to help people remain in their community. But we're much more of an agency other than just nutrition. And I'll give you some examples. Under Title III of the Older Americans Act, certainly there's nutrition services, both at the senior centers, such as congregate sites and home delivered sites, but there's also healthy initiatives, such as chronic disease self-management programs, where people can learn about their disease and they can manage their disease. Also strength and conditioning, wellness programs to keep people vital and engaged in their community and healthy, learning about nutrition. Another thing that we have, which gets to your question, is under Title III, we provide home supports. So we can help people with personal care needs. We can also help people that live in the rural areas that have to carry in wood or have wood delivered. We have some flexibilities with those funds to meet the needs of the individual. So we encourage people to touch base with their area agency on, and again, Nassau County is Office of the Aging is where people would go, or to call 311 to see if they can arrange those types of services. They're called in-home supports to keep people in the community versus institutionalization.
Now, when you say 311, do you mean the 311 that the town of North Hempstead uses?
Yes, indeed. That would be a great place to
Okay.
start, because in North Hempstead, they can refer them to the county office. They work close, very close. And again, statewide, we have New York Connects. It's a network where people will know to get people back to the local resources. But 311 in North Hempstead is exactly where people should call.
Yeah, I mean, to me, that's one of the beauties of the Project Independence program.
Yes.
Is you call 311, you get caring, knowledgeable nurses and social workers who can evaluate your needs and your situation and then steer you to things like ACL in that path, as opposed to trying to figure. My mother lived with us for 11 years, and my wife and I were both working, and this is back now a few years now, 15 years ago, more, maybe 20. But the point being that programs like this were not known to me or my wife, and 311 or Project Independence didn't exist. And had it existed, it would have made our lives much easier, because I would have contacted 311, and each level along the way, they could guide you and talk to you about stuff like the benefits that ACL offers.
Well, exactly.
So to me,
well, you mentioned caregiving, which is what we recognize. We have more older adults providing care either to a spouse or even to children and grandchildren, believe it or not. Many grandparents are now raising grandchildren. They need support. Title III-E, under the Older Americans Act, is a specific funding source for people to receive services to support caregiving. It's a plethora of information in the Older Americans Act to support people in the community. And again, 311 is a great place to start if people have those questions.
The 311, as Otto just said, Otto, that was a perfect commercial for Project Independence.
Yes.
It's so tremendous for the town of North Hempstead. It really is. There's no place like it in the country now. And my 3 out of my 4 grandparents at one point lived with us for several years at a time because they didn't go into nursing homes. We didn't have a big enough house because my mother had 5 children. So we were all upstairs. They converted the basement as each one lived there, but there wasn't a shower in the basement. And I'm a big boy. I had to carry them up 2 flights of stairs to get them into the tub and stuff. And it was like, my mother's like, this is not your job. I said, Mommy, you can't do it. So how are they going to get upstairs? But that's how people lived then. There had to be a service someplace, but you didn't know about it. My mother was not the person that would start inquiring, like you take care of your parent and that was it. But you can't help but understand what Project Independence is out here doing, that you can talk, it comes up in so much conversation. It's just one tremendous organization. And then of course I'm going to give a plug for not the TV show, Christina's radio program, that the people that come on it. Kathleen, you're being a perfect example today. And I know this show gets listened to, and now it's being put on the North Hempstead TV. That hopefully that's not even going to continue after this pandemic is over, because Dan edits it. And we have this 1-hour section go on, which is tremendous, which means, Kathleen, everything you're saying is going to be on for a week or 2 weeks on TV every night.
That's
got to
awesome.
get the word out there.
That's right. And as you say, John, and I think it bears repeating as well, people sometimes feel shy about asking for help. They think they're not deserving or they feel embarrassed. And again, these are trained counselors on the other end of the phone to listen carefully to what the needs are. And again, no one should feel uncomfortable making those calls, because that helps you actually to be stronger and to be more vital in your community when you're healthier and you're feeling good about yourself.
we all need counseling of various things in our life. Nobody is born with all this stuff injected into you. And, there's really no reason in the world why you can't ask for help. there's just no
That's
reason.
right.
And also, I think this is just my opinion. When it's thrown in in a group environment, it's
Yes.
almost not the same as asking for help. I look at it, like when you go to the advisory committees, you go to different things. You're just one of many. Because I'm going to hear that Kathleen asked and Christina asked and Otto asked, so I don't feel like I'm on my own doing this. There's other people in the same situation. Good, Kathleen.
Oh, you're right. Sorry, John, but I so agree with you because I can give you two quick examples. It's the chronic disease self-management program that many of our senior centers encourage. They are doing group exercising now all across the nation, encouraging people to exercise together. And these are people who've had strokes, who don't have flexibility, but they're all there, they're all engaged, and they're all benefiting. Another example is a resource we have right here in New York called Older Adults and Technology Services, OATS, O-A-T-S, Older Adults and Technology Services. They teach, train people, as I make mention, how to use the internet, how to get involved in some of the programming that's available online. And people are many times embarrassed to say, I don't understand computers. It takes away all of that sting, gets them in comfortable small groups, teaches them how, and that happens on a wonderful basis on two levels. One, they're learning information and education, but secondly, these small groups, these small learning groups, they become partners, and they engage in conversations for years to come. So there's a lot of information out there. It's just knowing where to go, and secondly, asking for it.
Very true. And it really is. And I don't mean it the way it sounds, but it's almost like sneaking in.
Yes.
You know what I mean? You didn't blatantly ask for something. All of a sudden you made a friend. It really is. Time-wise, when I was going for my master's in gerontology, and one of the things we had to do was ask people questions. And my report was manja memory. And that's why I did a report on, I asked people, I gave out a questionnaire, and I asked people to give me their favorite recipe from when they were growing up. And by the time they finished giving me the favorite recipe, they were willing to answer any question I had. Because then I said, well, what happened there? And then my sister did this, my father did that, my mother did this. They were talking about anything. But
Yeah.
it was, I don't mean it was a trick question. First, I got them talking about peas and carrots or string beans. I didn't like the mashed potatoes. And it was just circumventing the heart of it. But then we got to the heart of it.
That's right.
And that's really what this kind of stuff is. People don't know sometimes what they need. And at the same other times, they're afraid to ask. And here,
That's right.
we have places like the ACL that your whole function is to help them. You want to help them.
Oh, we are not a compliance agency, and we support our state government in really understanding the technical pieces of the Older Americans Act so that they stay in line with the requirements. But much more importantly, we want to share best practices, good ideas. We're always connecting one state director with another state director so that they can learn from each other. And as you say, along the way, you're creating new relationships, new friends, and it really is it's a positive effect for older people throughout the nation when we do that.
100%.
Not all government functions are negative.
Thank you. My background, I've been in aging service my entire life, and with the opportunity to come to federal service, it was a great chance to serve more people more broadly. And I think the people who work for federal government would appreciate your comments much as I do, because we're there to help, and in a sincere way, especially at the Administration for Community Living, which I have a little bit of bias for, but other than that.
But you know what? In all these agencies, I find, and the different ones that have come on the radio, you're not doing it unless you want to. And a perfect example, I'm going to skirt this over a few minutes because we don't have that much time before the next break, to Christina. What Christina Liu does for Project Independence is above and beyond. Why does she do it? Because she wants to. Whether it's the newsletter, whether it's the email letter, whether it's the radio program, whatever she's doing, it really becomes a project of love. And that's what, Kathleen, you're coming across the same way. And everybody we come on this radio program, because if it's just a job, we don't need you. There's many people that will take the paycheck, but not do as much, not doing as caringly, not doing as lovingly, and most importantly, not doing with the degree of concern that you're offering. And that's why, you know, that's just my opinion. That's my 2 cents for everybody here.
Well,
I agree 100%. You have to be engaged in what you're doing, and you know, whatever that requires. And if you're not really engaged in it, you're kind of just drifting through it. And okay, that's your choice. Everybody has a choice. You can really get engaged in what you're doing, or you can just drift away.
Kathleen?
Well, I just want to say everybody's aging. We're all seniors in training. And just like Project Independence, we have to continuously teach and help each other along the way.
Perfect. What we're going to do now actually is take a break because I have a few more questions for Kathleen. We're going to come back. You're listening to 88.1 FM and WCWP.org, which is Project Independence and You. We'll be right back.
Project Independence is the Aging in Place initiative of the town of North Hempstead. One of the many services we offer is transportation for food, shopping, and medical visits. Call 311 or 869-6311 to get more information or receive services.
Welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Lohse.
Enjoying every minute.
I know. And we have with us today Kathleen Otte, and Kathleen is the bi-regional administrator for the Administration for Community Living, ACL, which is just a phenomenal organization. And what we've been talking about so far today is just, it's tremendous. And this is really the tip of the iceberg for trying to help people. And Otto, just as we went into the break there, you brought up something.
Well,
let's go back to Otto then, and you and Kathleen will have a conversation about it.
we talked about doors, right?
Right, doors.
And that there's no wrong door. And I understand that there's a program called that. And I was just curious as to what that was all about, Kathleen.
Well, thank you, Otto. Indeed, we, over the course of the years, and I'm speaking about 20 years ago, recognized that older adults don't want to be passed around from one resource to another. And it behooved the federal government to say, let's create, by way of grants, nationwide, what are called no wrong door systems or Aging and Disability Resource Center. Those two terms are interchangeable. No Wrong Door system started out with grants to all of the 50 states so that there could be one system where people could go and ask for information. It's really been very helpful because in some parts of our country, when there's not a plethora of services, those No Wrong Door areas really help them find the resources that people need. New York was New York Connects. It started out about almost 15 years ago, but the challenge was it was not statewide. About 2 years ago, Greg Olson, who is your state director on aging, made New York Connects a statewide entity. And we have 800 numbers that people can call where they can get information on services locally because there's a New York Connects office in every county. So we're very fortunate for that. That's the No Wrong Door system. It started many years ago. All 50 states have them. And now we can say New York State is statewide.
How would I use this system?
I'll give you a good example. Say if you're providing care, and we'll use the example when you had your mother in your home and you were providing care. If you felt as if you needed to get a meal delivered to her every noon time just because you were working and you needed her to have a nourishing, nutritious meal, you could call New York Connects or 311 and get information about home delivered meal services. Again, you're not passed from one place to the other. New York Connects is a one-stop shop, one door where people can get all the information they need, whether it be services or information or where resources are throughout the state. It's just a very important service that New York has really invested in. Every counselor at New York Connects has gone through a training program through Boston College where they are very valuably trained service workers that understand older people and people with disabilities, and they also are well versed in the resources in their community.
Sounds good.
It's a wonderful network.
not only is it a wonderful network, it seems that it's easy to navigate. I mean, you're doing all the work.
That's right. That's right. And it was set up that way because we, in times past, people would get passed. Maybe it's a difficult question, a difficult request. They would just get passed. That's not the case. That initial request goes right into New York Connects, and they are working the challenge and the problem to make sure that the services are there. We don't serve people in institutions with New York Connects. It's really community-based.
Okay.
That's a difference but again, it's worth repeating. If you have question, New York Connects is exactly where you should go, or 311 in North Hempstead.
And going back to that 311, always use the 311 if you don't get satisfactory answers. In a place like New York Connect, you get an answer. But we had several weeks ago Joe Galante on from the New York State Controller's office, and
Yes.
they had confirmed all the phone numbers in their financial pamphlets, because there are situations when a phone number may have gone dead. And you call
That's
it,
right.
and it says leave a message, but nobody's going to hear that message. And you do it 3 or 4 times, and for a senior or an adult child out of state trying to help the senior, it gets very frustrating, that you want to talk to a person, or at least make sure that the system you're utilizing is up to date. Go ahead, Kathleen.
Well, absolutely. And as we get older, that human contact is much more important than leaving a message. I think as we all get older, we never really want to do that. We never know where it goes. But when we have somebody on the other end of the line that is trained and very well, very knowledgeable about the resources, we have a confidence as an older person that maybe our voice is being heard. And I think that's really important.
Definitely.
Absolutely. One thing I just wanted to touch on, and Otto, you might be a beneficiary, not a beneficiary. You could help us out with this. Different tips on people getting together. The pandemic's going to be here, I have no idea, for months to come. I don't see everybody jumping into a square dance tomorrow, personally. But to be safe, you shouldn't. I mean, nobody has the answer yet, so why go there? And I know the town of North Hempstead has technology for the petrified and different things to help seniors become a little bit more computer literate. And one of the things that I see is a virtual coffee chat, and which is interesting because our congregation, which is the Unitarian Universalist congregation in Shelter Rock, they closed the church, and they closed it months ago, and it's going to be closed until next spring. Already they closed it, but they have services, and after services, they have a virtual coffee chat because people used to hang out after services. Is it the same? Absolutely not. Because I could go over to a table and say, Kathleen, I need to talk to you about something. I'm not doing that on a virtual chat. But it's an interesting concept for virtual chat for seniors. Whether it works or not is another story. I know they've tried some of the advisory meetings this way. What's your thoughts there, Kathleen?
Well, I think it's wonderful. It's stimulation, and also it's keeping people engaged in the day-to-day, whether in their local community or even national news. I can imagine that there's probably a lot of great conversations that are going on with people on various topics. I mean, even travel videos, talking about where people have gone, what their experiences have been. Now, sharing information about maybe a craft that you have or a talent that you have. Again, I think it's just wonderful because it's really about the interaction. We as human beings require social interaction, and this pandemic has really challenged us to think differently. So people are making new acquaintances, and that's stimulating, and that keeps us focused on the life that we live and engaged in our community, which I tend to repeat, but I think it's so important, especially during this time.
What's interesting is I walk, and when I walk, I make a point of ducking and dodging and don't go near anybody. And a lot of times I will try to...
During the pandemic, or you always do it that way, Otto?
Pretty much. But typically I would try to say good morning or whatever. It's like a lot of people are afraid to even look at you right now. Forget about, saying good morning or how you doing or whatever. So when I walk, I try to look at the people, and then they don't look back.
Right.
It's like maybe they're going to get COVID by looking at me. I don't know.
But I think again, you raise a great point in that there's fear out there. People are very fearful, and that just drives people in. And the joy and the beautiful thing about the innovation that we see in New York specifically is that it's really capturing that and making, giving people a safe and comfortable place to engage, like, as you say, with computers and so forth. But I think the fear factor is real, and depression and social isolation is also real. So it's a balance at this point.
It's a big balance too, and we're going to get there, is this handshakes and hugging and stuff.
Right.
I mean, you don't do it at all now, but I'm a hugger. There's no question about it.
I'm a hugger too.
Oh, so but I'm avoiding, honestly, I'm really not that with that many people, etc. So what, like you're talking about, Otto, you kind of walk away. So when the time comes that you're in a crowd, does everybody really stay 6 foot from each other? And I say, hi, Kathleen, hi, Otto, hi, Christina. Like, it's a whole new world, and I have no idea how it's going to be dealt with. But we just have to be safe, and especially from a senior, we have to go out there and instruct them to go out there very mindful of being cautious.
Well,
that's right.
I'm sorry, Kathleen, go ahead.
No, I defer to you, Otto. Go.
Well,
go
no, I
it.
have a scenario, as John and Christina know. I rented a house. We're going to go to this house with like 16 people, family, all. It's an estate basically, and 8 bedrooms, 8 bathrooms, everybody. But here's the thing, everybody, and we're a hugging family, but we're not going to be hugging. I'm going to be with daughters and sons and grandchildren. And that's an interesting idea of how, like there's a little bit of a strain there, if you will, even though we're all family and we've all trying to behave. The fear factor is back here, whether you know it or not. It's
Absolutely.
in all relationships.
Well, it is. And again, I think, John, you touched upon this. What is our new normal? No one really knows. As we grow older, we know that human touch is so important. Nursing facilities, thrive upon that. Volunteers always will go in to a person who's at bedside and touch them. That's going to be a real challenging thing. Science is going to lead us, I'm sure, but hopefully we'll find that middle ground where we can really feel that human connection. Again, as we grow older, and especially as people are at the near end of death time, we have to have that. We need that, and we'll have to find our new normal.
Here's an area now, new one, not new, but nursing homes. I have a couple of people that I know that we did visit occasionally, and now finally they opened up. You can go, but you can go for, I think, 10 minutes every 10 days with 2 people. So, okay, that's better than nothing. But if you have a large family, that means that most people can't go because the primary mother, father, or whoever, daughter, son, are going to be the ones who'll go and nobody else can go. That's an example. Even though they're in a institution with other people around them, people in nursing homes are really, really isolated. Seriously.
They are. Well, they are, Otto. And under the Older Americans Act, Title VII has an ombudsman program. Every nursing facility has an ombudsman that becomes an advocate for the residents. They may work for the state, but they do not. They are an advocate for those people in nursing facilities. Because of the pandemic, we've not been able to get into those facilities. As you mentioned, now things have opened up. Our ombudsmen are back in the facilities, and they are doing their work to be an advocate for our residents.
That's unbelievable. That's perfect. And to know that's out there is comforting for people who know there's somebody in a nursing home. Kathleen, as you said earlier in the program, it always goes so fast. I want to thank you so much for taking the time out of your busy day with all that you're doing. I want to thank you for all that you're doing. And I want to thank you specifically for coming on our program. And I wish you to be safe and well.
Like what you hear? Here's how you can let us know. Give us a call at 516-299-2626 or email us at info@wcwp.org. Like us at facebook.com/mywcwp and leave a comment or tweet us at mywcwp. We welcome all kinds of feedback. To directly support the podcast you just enjoyed, leave a review on Apple Podcasts. And if you'd like to give back, visit WCWP.org and click the support tab. Thanks for listening from your friends at WCWP.